However, an encouraging sign of this large COVID surge, the number of people admitted to our hospitals for COVID-19 actually ticking down over the past couple of weeks. But that number still remains much higher than last summer's peak.
ABC 15's Mike Pelton seeing if those on the front lines are feeling any relief and whether this downturn will last.
The hospital's still full. ICUs are still all double capacity. That's because, when you get sick, you're sick for weeks.
Dr. Brandon Lawrence is an emergency physician at a Valley hospital.
I just get surprised when people still don't believe that they have it. I mean, it happens where you tell them they have COVID and someone was like, "What's that?" And I'm like, I can't deal with this today. I don't have the patience.
Coronavirus patients still filling hospitals, but there are some promising signs. After exceeding 5,000 earlier this month, the number of COVID-19 inpatients at our state's hospitals on the decline, down to around 4,200.
Cautiously optimistic, I guess, would be a good term for it.
In his latest COVID-19 modeling report, University of Arizona Associate Professor Dr. Joe Gerald writes, quote, "This week saw a large, unexpected decline in COVID-19 cases." He cautions some of the improvement possibly short-lived, speculating holiday school closures could have played a role.
Many workplaces were closed or working very different hours. And so if people aren't interacting in the workplace or schools, that's going to likely slow transmission. And so I think that's a likely explanation of what's happened.
What will happen remains a fluid situation, but Dr. Lawrence knows what he's overcome.
Chaos, PTSD, man, there's a lot of healthcare workers out there that are really, I think, kind of done with the profession.
And COVID still not done with all of us. Mike Pelton, ABC 15, Arizona.